Hello, my name is Fawn Lopez. I'm the publisher of Modern Healthcare, and welcome to Fridays with Fawn. In this video series, I will be talking to my friends and colleagues about the issues women face, our struggles, and more importantly, how to overcome them in order to grow both professionally and personally. So I have the pleasure to speak with one of my favorite people in healthcare today, Deb Canales, EVP, Chief Administrative Officer of Providence St. Joseph Health. And Deb is also one of Modern Healthcare's top 25 women leaders in healthcare for 2019. She's also one of our top 25 minority executives in healthcare for 2020. Welcome, Deb. How are
Thank
you?
you, Fawn. Cheers!
Cheers.
Let's do it!
So you and I have known each other a long time.
A long time, yes.
And you've been such an inspiration for so many women in healthcare, me included.
Oh, thank you.
It's been such an honor to know you. You've been a wonderful mentor as well. And so for those that don't know you as well as I do, would you please share a little about yourself? Where did you start out, and what led you to your current role at Providence St. Joseph?
Well, thank you. And before we get started, just a big gratitude for this invitation and this coffee talk that we're having with one of my most favorite people in healthcare. And I am just very blessed. Half of my career is in healthcare, and the other half working for global Fortune 500 companies in retail, food service, and technology. And once I moved into faith-based healthcare, I'll never go back. It has just been such an inspiring journey. So as you mentioned, I serve today as the Chief Administrative Officer for Providence St. Joseph Health. And in that capacity, I oversee all of human resources, communications, our community partnerships, our community boards, foundation boards, and it's just such a variety of just wonderful areas to really serve our ministry. And prior to that, I was almost 10 years. That's where I met you when I worked at Trinity Health. So you and I go back, I think, over 15 years, and it's just, it's wonderful, and it's been an incredible journey. You know, I feel that my calling is about helping to ignite people to find their full potential. That's why I feel God has put me here on this planet, to really be that connector. And as I've matured and navigated through a variety of different organizations, my mantra now is about, I will not trade wholeness for approval. And so really being an advocate for women and men as part of their potential, and really helping to bring up the up-and-comers and really help them navigate through all the challenges that we're facing today is what brings me such joy and inspiration.
And all those things are things we talk about at Women Leaders in Healthcare. And can you believe that is this year marks our 10th anniversary?
Oh my gosh!
Wow! I can hardly believe it. And yes, you hit the point so perfectly. We both have been passionate about career advancement and big advocates of women and minorities in healthcare. But according to a study conducted by McKinsey, women, especially women of color, are still underrepresented in leadership positions in healthcare, in the C-suite, in the boardrooms. What do you, when you think back on the last 10, 20, even 30 years, what stands out in your mind? The struggles that women face, our advances, the advancement that we've made, and how the environment really has changed for women in healthcare.
Yeah, it's a great question, Fawn. And I feel very blessed to work for an organization that was founded by women over 165 years ago, and I think it's their spirit of really focusing on justice and equity and respect and compassion that really inspires me each day. And as I look back, going back in terms of probably over 40 years ago, but just the first woman CEO who was appointed was back in 1972, Katharine Graham, and she was the first CEO of a Fortune 500 company, the Washington Post. But something that really touched me, I'm a big tennis player, and so when I was in sixth grade, I was trying out for the high school tennis team. And this was in September of 1973, and it was the Battle of the Sexes when Billie Jean King played Bobby Riggs. And 2 years prior to that, Title IX had just been passed. But nothing was more significant in terms of that sports program that was viewed by, at the time, a world record, like over 90 million people. I lived in Houston, that's where I grew up. And so it was played in the Astrodome in Houston. And so watching it with my dad was really special. And just what she represented in terms of really breaking the glass ceiling once again, to put at parity women in terms of athletics, to have equal pay and equal opportunities. And she continues to be such a legacy today in terms of continuing to pay that forward. And then in 1999, Carly Fiorina was the first woman CEO for a Fortune 50 company, and I happened to be working at Compaq HP at the time. And so that was just a really incredible time. And most recently, I think it's the Me Too, the hashtag Me Too movement that started in 2017 that really brought forward the opportunity for women and men to be very vocal and prominent with regards to sexual harassment and sexual abuse in the workplace and anywhere. And that movement that continues to be created, and it's certainly inspired us here at Providence St. Joseph Health with regards to our own movement of hashtag not here. It's our response to the hashtag Me Too movement. And it's instilled by the sisters who were very prominent in terms of upholding justice and respect and dignity for all, and that no discrimination will be tolerated with regards to our commitment in this organization. And, that we want those issues to be brought forward so they can be investigated immediately and addressed immediately. But I think it's really taken a stand, being vocal, and a movement, throughout our organization that's very important and very, relevant in terms of what we're witnessing today.
Exactly. And I wanted to, I would be remiss if I didn't talk about the current events, what's been happening. So the protests that have sparked a movement in the wake of Mr. Floyd's death and now Mr. Brooks. This was not the first time we've had to confront racism, but hopefully, I'm hopeful that this time it will lead to real change. Yeah. That as an industry, as a country, we will create meaningful change for minorities. And I'm also hopeful that women issues will also be part of the conversation. And to that extent, as leaders, as women, I believe that we have the responsibility to ensure that the focus doesn't fall off the radar. So you've attended Women Leaders Healthcare Conference a number of times. 3, 4, maybe 5 times?
Oh yeah, at least.
And so can you share with our audience what do you remember most about your first experience at Women Leaders?
One of the most memorable times was when I was on a panel, and I told my personal story about my own marriage and domestic abuse and just what I went through. And that just came out spontaneous. That wasn't planned, but you created a safe sanctuary. And my closest friends, I mean, there was 800 people in the audience. And but it was so powerful to be able to speak my truth, to know that it was safe, but more so the outpouring of women afterwards that approached me to thank me for coming forward, and now that they have an avenue in terms of what to do or how to get out of a situation, but just to give them courage. And so I'll never forget that moment because it was so healing and powerful for myself.
And
And
for the rest of the people in the audience. I
yeah,
remember there was not a dry eye in,
yeah,
in the audience. So thank you
yeah,
for for your courage to share something
thank you.
that's so
Yeah.
personal, and for that I'm always grateful. And
What I think that's what keeps me coming back is that we create this beautiful community of like-minded women and men,
yeah,
who are after the same thing. And I would never create the type of connections across the country that I have today without, this forum and this ability to really speak truth to power, to engage in those kind of conversations. It's very, powerful.
well, thank you so much for that. And so, what I'm really excited about this year uh, is being able to bring Women Leaders in Healthcare Conference to our audience virtually, right? So,
Right.
to keep them safe and to help them eliminate the expenses associated with
Yes.
travel. So, uh, we're able to, I think, the content, we're able to deliver this crucial content in the way that enables the participants, the audience, to engage, to participate in real time. And if they want to, they can also always uh, connect or catch up when their schedule allows. And so it's easy to be really skeptical about virtual conferences, but I'm so excited about to share to the audience what we've been working on for them. So we've been able to again create an agenda that is second to none, but also incorporated. We've been able to incorporate virtual networking environment and virtual exhibits uh, that will make it easy for attendees to talk, to connect, and to get to know one another. And especially if you're a little shy, the virtual environment is a lot less intimidating, in my opinion.
Yeah. Yeah.
So, and I want to thank you for your participation
Sure.
at on the advisory board. You've been most generous with your time and feedback and advice. What are you looking for in terms of your experience at this year's event?
And I guess what I'm hopeful for is that we continue the inspiration of the moment that we're in to really change the conversation. I think women have an opportunity now because of our commitment to compassion. And in this time, compassion is rooted in being with and really engaging and hearing and listening and trying to get at, what's really there and really helping to shape that conversation as we think about the pandemic, social injustice, the workforce of the future, opportunities, and that people are able to leave with some real tangible activities that they can go take back as they reenter from this experience. And you've crafted the sessions, so that in terms of the time commitment, listening to all the participants in terms of what they really wanted to hear. So it is just a beautiful show flow, and I think people are going to be just really excited and take away so many gifts from this experience. And
Well,
thank you
thank
very
you
much.
for being my first guest on Friday
Woohoo!
on. Yay!
Yay!
And you've been fabulous as always. You're fabulous, and I
Thank
hope you had as much fun as I did.
Yes.
And I thank you for your passion and commitment to advancing women and minorities in healthcare. And I look forward to seeing you, connecting with you at Women Leaders, hopefully before and for sure after.